Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Good evening, beautiful, amazing, mind blowing people on this planet. Thank you so much for all the love and support. Thank you for making Pediatrics by Dr. Anand a super hit success on this small, cutest planet known as Earth. Beautiful people. Hello, everyone. Hello, Dr. Awesome, Karan, Alfaz, Sushmita Mondal, Karan, Vikram Singh, Priya, Osama Sheikh, Shubhangi, Shubham Mansi Panola, Sone Patole Lakha, and Sorangshu. Cute name. Good evening, everyone. कैसे हैं आप सब लोग? कैसे हैं आप सब लोग? Let's start this beautiful class. I hope you guys are amazing, beautiful, perfect on this planet. Good evening, beautiful people. Did you guys miss me? We had a super hit class in Jaipur. We had a amazing class. We had some beautiful, बहुत मजा आया. I hope you guys saw on the Instagram and YouTube channel. I have done we had a revision test in the 3 days rapid revision of pediatrics in Jaipur. Please watch day 1, day 2, day 3 Jaipur class on YouTube and on our Facebook channel. You will love it. Hi Humanshu. Hello bro. Let's start this amazing class. My name is Dr. Anand. Today's topic of choice will be most importantly recall questions of the last 5 year of NEET PG. I'm going to start with NEET 2022 this year question paper recall questions. I mean, it's just a recall questions. It's the question which we think I discuss with the students. So it's like a sum up of the recall questions. The only thing I want from you everyone is number 1, be happy in life. Life is so beautiful. Number 2, just enjoy the show. My name is Dr. Anand. I am MD Pediatrics. I have done my MBBS from Rajiv Gandhi University, Health Sciences, Bangalore, Karnataka. Then I did my MD in Pediatrics. Then I did my SRC from Lady Harding Medical College, Hindu Rao Medical College. Then now I'm working as assistant professor with some amazing teaching experience with this butterfly going here and there. And also we have this beautiful expertise in teaching all the beautiful UG, PG, DM and MRCPCH exam going students. Today's topic of choice we're gonna talk about is last 5-year NEET questions starting with NEET 2022. Before starting any amazing super hit mind-blowing session, we always have a motivating quote, and today's motivating quote is entire water of the sea can't sink unless it gets inside the ship. Think carefully my friends, hear this thing. Okay, it's a good one. Entire water of the sea can't sink unless it gets inside the ship. So moral of the story is negativity of the word can't put you down unless you allow it to get inside you. Please remember, this is a beautiful quote, my dear friends. I'll repeat again. Entire water of the sea can't sink unless it gets inside the ship. And same way, negativity of the word can't put you down unless you allow it to get inside you. What is the moral of the story, bro? The moral of the story is you are the only architect of your life. Either you can make your life very constructive or you can make your life very destructive. Either you can be positive for no reason, either you can be angry for any reason. Do you agree with me? Yes or no? जिंदगी भगवान की एक बहुत ही ज्यादा महंगी गिफ्ट है. हर पल ऐसे जा रहा है जैसे पता ही नहीं चल रहा. सो प्लीज, लाइफ इज द मोस्ट ब्यूटीफुल थिंग व्हिच हैज एवर हैपेंड टू यू. सो लिव द मोमेंट, लिव क्रेजीली, जस्ट बी हैप्पी फॉर नो रीजन. कैन वी स्माइल फॉर नो रीजन? Can we be happy for no reason? You need to buy a Titanic ship, then only you'll be happy? You need to buy a big bungalow, then only you want to be happy? No. You should be happy for whatever you have, wherever you are, and however God has made you, because you are most beautiful. That's it. हम हैं, बाकी पानी कम है. I frankly tell you, it's very important to love yourself. If you don't love yourself, if you don't respect yourself, if you don't groom yourself, I mean, what's the use, you know? Don't live for impressing other people. Live for your craziness. Live just because you are happy. That's it. Okay, so do you agree with me? Hello Osama, Shubhangi, Kalicharan, very good. Priya, let's start this beautiful class. And this is such a beautiful quote which says, work hard in silence, work hard in silence, let the success makes the noise, let the success make the noise. Okay, So we're gonna start this beautiful topic with the NEET PG 2022 recall questions, guys. Recall questions. Okay. Okay, let's start this. Okay, and also there was one, one AIMS rank 2 topper. He was asking me, how should I improve my efficiency for exam? Can anyone answer in the comment section? Sir, I'm reading medicine. Whenever I read medicine, I forget gynae. And whenever I read gynae, I forget forensic. So what is this? Sir, I'm able to understand what are you trying to teach, but I'm forgetting. मैं भूल बहुत रहा हूँ. I'm forgetting a lot. Can you please comment in the comment section? How should I improve my efficiency for exam? Yes, very good. The first thing you can be very, very efficient is number one, you must have a timetable. Should have a very beautiful timetable, my dear friends. If you have a timetable and if you stick yourself to the timetable, you are amazing. You are just perfect. You must have a timetable. Osama, Shubhangi, all the beautiful, amazing people, I want you guys to rock it, okay? And you must have a beautiful timetable with you. Number one. Number two, in the morning, basically 1 day prior, your timetable should be ready. While brushing your teeth, your timetable should be set inside your mind, inside your notebook. Okay, this I have to study whole day. After lunch, I feel very sleepy. Let me revise some previous year MCQs. It's easy. In the morning, I'm very energetic. Let me read a very tough topic. In the night, I'm so tired. Let me just watch a video section of Pediatrics by Dr. Anand and let me just laugh little and chill out and sleep off, right? So this is how beautiful you should incorporate your timetable. Also, at the same time, I have tried my best for this one. Avoid cramming and start understanding the concept. Avoid cramming and start understanding the concept. I always try my best to discuss the topic as much as possible. It's really important. Do you agree with me, Osama, Shubhangi, Karam bol raha hu, Karan, Monimala? So it's very important for you to understand the concept. Don't cram. Baby came with jaundice. Don't cram. Phototherapy is the treatment. Phototherapy, my grandmother also knows. Oscar को भी पता है कि phototherapy कराते हैं. Okay, even my grandmother also knows phototherapy. Blue light is the treatment for phototherapy. But that is not the solution. The solution is why the baby is yellow. Why the baby is yellow? Is it cephal hematoma? Is it RH incompatibility? Is it ABO incompatibility? Is it hemolytic anemias, thalassemias, enzymopathies, membranopathies? What is the reason? Reason is important, not the cramming business. Next, also we need to understand, sir, could you please tell me could you please tell me what you call important 10 topics of pediatrics? I'll cram nicely and I'll pass with rank 1. So if you are thinking that, I will first kill you, then I'll tell you last 3-year question papers. Last 3-year question papers are really important. Solve them as much as possible, and that is why after our successful cardiology class, we are doing the last 3 to 5 years question papers of AIMS, NIMHANS, JIPMERS, NEET PG and Hfmd, also with INI CET. And I'm planning to share DM and MRCPCH questions to you also, because they are really amazing. So you'll have fun. It will be great. It will be amazing because they are literally conceptual based questions. Cramming is less and understanding is really more. Also, at the same time, take short breaks. In this beautiful life, good evening, Dr. Shubham. How are you, Dr. Shubham? So in this beautiful life, take short breaks, bro. Don't copy him. Don't copy her. Sir, my girlfriend was telling study early morning 4 o'clock. Okay, early morning 4 o'clock is the best time to study. So she might be studying early morning, but maybe I am a night person. Yes or no? Maybe I study more in the night. So tell me in the comment section, how many of you are studying in the night and how many of you study in the morning? What do you think, guys? Yes, exactly. Osama, Shubhangi, Bate Maro Damake, very good. Yes, take short breaks. If you want to study in the morning, bro, study in the morning, just chill. That's it. Also, at the same time, proper meals and rest. Eat properly. I love eating. You should also eat properly. That's it. Okay. I have my friends who starve a lot. They study for 6 hours and they have huge headache. No, please take care of yourself. Please take care of yourself. God wants one thing from you, is to take care of yourself. If you cannot take care of yourself, you cannot take care of the planet. First take care of yourself, then take care of the planet. That is why I really love myself. I eat a lot. I buy good perfumes. I smell good. I brush my teeth twice a day. I go to gym. I run. I talk positive, because if I feed good things to myself, then only I'll feed good things to the planet. Do you agree? Yes or no? Do you agree? Yes or no? If a mother is pregnant, if she will not eat properly, baby will not be fed properly. Are you understanding? If a mother having hemoglobin 4, can the baby will be hemoglobin 20? I doubt. Turn your focus towards the process. That's a very beautiful line. Can we please focus on this line, my dear? Turn your focus towards the process and away from the outcome. Away from the outcome. Sir, I don't think so I can do it, sir. My friend was telling that एक attempt से तो किसी का आज तक नहीं हुआ, तेरा कैसे होगा? By single first attempt, you cannot get a NEET PG or a Hfmd rank. That's what my senior told, sir. Remember, you are amazing. You are perfect. That's it. Do you think everyone, do you think you have the guts to clear the exam in first attempt? Tell me frankly, yes, maybe, or no. If you think yes, you rock it. Also, at the same time, frankly speaking, be familiar with the structure of the exam. These are very $1,000,000 advices, okay? Please pay attention, bro, everyone. These are very important advices. Padhai to chalti rahegi, study will be there, but this is something AIMS topper had told me, and they told me to share it with you. They got a rank too, and they said, Anand sir, please share this with the rest of the planet because this was helpful for us. And isi bahane, the students will get a very good rank. Be familiar with the structure of the exam. How is the exam pattern? How many question comes? How much is the negative marking? People message me on WhatsApp, मेरे 3 question गलत हो गए, 1/3 negative marking है कि 1/4 negative marking है? I have 3 to 4 questions wrong. Sir, 1/3 negative marking, how much marks will I cut? So if you have some doubts, talk to your seniors, talk to your batchmates and try to figure it out. Also at the same time, one beautiful advice I can give you, bro. If you get stuck, move on. There are various mortality rates. There are various numerological values which keep changing yearly. Like most commonest causes of causative organisms keep changing. If you get stuck sometime, if you're wasting a lot of time, please move on. Please move on. Don't waste your time much. I've seen students wasting 3 to 4 hours. Increase the beautiful content of your memory. Today we're going to talk about easy topics. Tomorrow tough, then again tough, then again tough. So increase the content of your memory. It will be amazing. And last but not the least, your eyes can't see. Your eyes can't see what your mind doesn't know. Your eyes can't see what your brain doesn't know. If the examiner has told a 2 days old baby having jaundice, so your brain should know that a beginning 1 week of life, like 2 to 3 days of jaundice is physiological jaundice. If within 24 hours of life someone got yellow, what will you think of? Physiological jaundice or pathological jaundice? Pathological jaundice within 24 hours of life, and after 24 hours of life, physiological jaundice. So these are some $1,000,000 advices, my dear friends. I hope it will be helpful for you. And let's just read the beautiful part. Oh, yes. First, okay, take a deep breath and let's read the question. A 4-year-old with white marks with foamy appearance on the sclera of the child. A 4-year-old with white marks with foamy appearance on the sclera of the child. Which of the following symptom is associated with the lesion mentioned below? What do you think, guys? Can you answer in the comment section? What do you think, bro? I think it's a very important question which we can discuss in this one. I'll show you that what you called that white marks with foamy appearance. This is the white marks with foamy appearance I'll be discussing over here. Can anyone answer in the comment section? Shubhangi, Osama, Shubham, Karan. Yes, amazing, beautiful people. What is this, bro? This anyone can tell it, bro. Can you please tell me in the comment section? What is this white marks with the foamy appearance? What do you think? Hello. So I think everyone knows about it. This we are talking about Bytod spots. Today is a very beautiful class with the amazing, crazy questions of NEET 2022 recall question. These are not the perfect questions, obviously. Some are here and there, so it's like a recall question. So what is this appearance, white foamy appearance on the sclera of the child? I think this looks like a Bytod spots. So the question over here is, which of the following symptom is associated with the lesion mentioned above? Angulostomatitis, deafness, glossitis, and conjunctival cirrhosis. What do you think, guys? Can anyone answer in the comment section? What do you think? क्या लग रहा है ये? So if someone having a bite or spots, which of the following symptom is associated with the lesion mentioned above? So I think you all agree with me. I think the lesion associated symptom, the symptom associated with that is conjunctival cirrhosis. Is conjunctival cirrhosis. Very important. Please remember, this is conjunctival cirrhosis. It's like you know, right? In the vitamin A deficiency classification, we have this beautiful bite or spots, and in the vitamin A deficiency classification, conjunctival cirrhosis, this is like the associated symptom, which you can say. Yes. Can you please tell me, sir, I am new student to your classes. Can you please tell me what are the symptoms, like what are the pointers in the vitamin A deficiency? We have X1A and X1B, X2, X3A and X3B. Dr. Osama, before I shoot you with my revolver, could you please tell me X1A में क्या आता है? कौन बताएगा? Yes, Shubhangi, what is the first thing comes in X1A? Is this the conjunctival cirrhosis or the corneal cirrhosis? See, in the eye, no, in the eye, first is the conjunctiva, okay, then is the cornea. Conjunctiva is like a full layer. So first, very important, please remember, we'll have conjunctival cirrhosis. And X1B, this is a very important question, guys. Bite or spots comes in which classification of vitamin A? The answer is bite or spots. So X1A, conjunctival cirrhosis. X1B, bite or spots. X2 में क्या होता है? It's very easy, bro. Very easy. Can we have good vibes, please? Good vibes. Take a deep breath. Good vibes. Positive vibes. Positive. Okay, see this. Okay, this. Can you get positive vibes from this biceps? Okay, good. Now I'm happy. Conjunctival cirrhosis, bite or spots. Corneal cirrhosis. उसके बाद क्या होता है? We have corneal ulceration. Corneal ulceration. In which part of the cornea you have corneal ulceration? In which part? So corneal ulceration in less than 1/3 of the cornea, and corneal ulceration in more than 1/3 of the cornea. NEET PG question number 1. Among this whole drama, which is the earliest sign and which is the earliest symptom in a vitamin A deficiency? Can anyone beautifully answer in the comment section? Osama, Shubhangi, Shubham, Manish, beautiful people, Monimala and Panola. Yes, the earliest sign, bro, is conjunctival cirrhosis. And what is the earliest symptom? Anyone? The earliest symptom will be night blindness. The earliest symptom will be night blindness, very importantly. Yes, and as for, I think you know that, we have scarring and the fundal changes. Remember that, okay? We have the scarring and the fundal changes, and the night blindness is the earliest symptom. Very good. So we have covered 3 beautiful questions of vitamin A deficiency and also the NEET PG for 2022 recall questions. Has everyone understood this much? Yes or yes? Jaldi bataएं. It's a beautiful class, guys. Did you miss me? 3 days we didn't have any class. Saturday, Sunday, Monday we did not have any class. Tuesday also. Saturday we had a class. Sunday, Monday, Tuesday. I had a very hectic schedule. I had amazing classes on Jaipur, and the Jaipur students were so beautiful. They were so amazing. बहुत मजा आया. And the students also, they loved the class. They liked it a lot. Like it was fun. We had a good time. Frankly, we had a good time. They were very happy. Next question, please. The next beautiful question on this planet is very importantly, yes. This question came in Hfmd exam also. This question came in NEET exam also. Rash over the neck. Rash over the neck with the history of child on the maize diet. Can you please close your eyes and tell me the best answer for this, please? Hello. क्या है ये? ऑप्शन चाहिए, ऑप्शन. बारात आई है तुम्हारी, यहाँ प्रसाद मिल रहा है बाबा जी का. ऑप्शन चाहिए, ऑप्शन. बिना ऑप्शन के बताओ. Tell me without option. Without option, could you try? Just one try? No. Okay, I'll tell. Rash over the neck with a history of child on maize diet. anyone having a staple diet. स्टेपल मतलब जिसका मतलब जैसे मेरी स्टेपल डाइट क्या है, व्हाट्स माय स्टेपल डाइट is my staple diet is chapati, wheat, cereals, right? Is my chapati is my staple diet. For South Indians, rice is the staple diet, and from some African people, we have the maize as the staple diet. So someone who is having maize as the staple diet, very very important. Remember them that they will have which problem? Yeah, very good. They will have niacin deficiency. Maize has deficiency in niacin, and niacin deficiency leads to, niacin is which vitamin? B1, B2, biryani. Biryani nahi, vitamin B3 is niacin. Yeah, so niacin deficiency, I think we all know about it. नाइसिन डेफिशिएंसी से क्या होता है? नाइसिन डेफिशिएंसी कॉज व्हाट? नाइसिन डेफिशिएंसी कॉज समथिंग नोन एज पेलेग्रा. So I'll repeat again. Vitamin B3 is niacin. Niacin deficiency cause pellagra. Yeah, okay. And the people who eat maize. Maize क्या होता है? What is the Hindi of the maize? yes bro. शुभम का देखो कितना अच्छा, शुभम बड़ा अच्छा हो गया यार तू. शुभम is very good. Like I'm very impressed. Like anyhow I'm very impressed with Osama and Shubhangi. Shubham is one third one with whom I'm very impressed. Nowadays answering very good. That shows that you are dedicatedly watching my classes. Otherwise I would have come to Vikas Puri and would have killed you. Yes, very good. What is क्या बोलते हैं उसको? What is yeah, exactly. Could you please tell me this one, sir? This also is same known as Kessel's necklace. Yeah, some says Castle's necklace, some says Kessel necklace. My English is not that great. So Kessel's necklace is basically because of the vitamin B3 deficiency. Vitamin B3 is niacin. If I am taking a lot of maize का मतलब क्या होता है? Beautiful. We have beautiful Osama who is answering भुट्टा. ये रहा, एक सेकंड कहाँ गया? ये रहा. Who likes corn? Raise your hands. Could you please corn? Corn अच्छा लगता है. I like corn. Which corn do you like? मुझे do you like that वो जली हुई मछली कह रहा हूँ मैं. हिंदी क्या होती है इसकी? है ओसामा? भुट्टे हाँ, भुट्टा ही तो होती है. भुट्टे की भुट्टा. डू यू लाइक दैट गरम वाला भुट्टा? और वो भी आता है ना, एक वो भी आता है उबाला हुआ भी आता है. डू यू लाइक बॉइल्ड और डू यू लाइक दैट इन सर्दियों में? देखिए नो, माई इंग्लिश इज नॉट गुड. ओके, लाइक आई डोंट नो व्हाट इज द इंग्लिश ऑफ सेइंग कि तुम भुट्टे को उबाल कर खाना ज्यादा पसंद करते हो कि तुम भुट्टे को जो वो उस पर जलाते हैं ना, मतलब क्या कहते हैं, गर्म करते हैं, वैसे पसंद करते हो. इसकी इंग्लिश खुद निकाल लेना और आंसर दे देना. ठीक है, क्यूट. नेक्स्ट क्वेश्चन प्लीज. So that's it. So maize has no niacin. That's important. And this is maize. Someone eating this will have niacin deficiency, and niacin deficiency causes apna pellagra. What about riboflavin deficiency? Can you please tell me riboflavin deficiency will have which symptom? Yes, exactly. Both I love. Okay, I thought you love us. I thought you love Dr. Anand and Dr. Osama and Shubhangi. Oh, I was mistaken. Oh God. Yes, exactly. Perfect. हाँ जी. So नींबू वाली काले नमक वाली. Karan, that's good. Karan is so nice. Like नींबू वाला काले नमक वाला. हाँ, me same bro, same. I also like with lemon with little काला नमक on that. Perfect. Yes. If I am having riboflavin deficiency, I will have something like this. Can anyone beautifully answer in the comment section? ये कौन है? ये कौन है जिसका मैं हूँ दीवाना? This is nothing but angular stomatitis. तू है वो तू नहीं. Yes, that's right. So riboflavin deficiency will cause angular stomatitis and cheilitis, whereas thiamine obviously beriberi it will cause, and we have a dry beriberi and wet beriberi. Wet beriberi if someone has a heart problem, heart involvement, we say wet beriberi. If someone having CNS involvement, we say dry beriberi. Last question, could you please tell me thiamine is which vitamin and riboflavin is which vitamin? Which one is B1 and which one is B2? Quick answers please. Quick answers please. Yes, you have 5 seconds to answer this question, then we'll go to the next one. Hanji, what do you think? Yes. Yes. Perfect. Beautiful. I think everyone knows about it. Vitamin B1 is thiamine. Vitamin B2 is riboflavin. Vitamin B3 is niacin. Vitamin B5, which is vitamin B5? I forgot. Got pantothenic acid. Pantothenic acid is vitamin B5. What is vitamin B6? Vitamin B6 is pyridoxine. B7 धीरे धीरे बोल कोई सुनना ले, सुनना ले कोई सुनना ले. Yes, B7 is biotin and B12 is folic acid. Folic acid. Okay, सर आपका आवाज़ सुन के बहुत अच्छा लगा और थ्रोट भी ठीक हो गया है. हाँ जी मेरे प्यारे भाई करण विक्रम सिंह. Yes brother, I am good. May God give you everything in life. Good vibes. Thank you. That's what. So that finishes this part. Has everyone understood this much? That riboflavin deficiency will have angular stomatitis and cheilitis. Thiamine will have beriberi, and folic acid will have megaloblastic anemia, and niacin will have pellagra. And yeah, this okay. Beautiful question. This question had come in DNB paper also, actually. So could you please answer in the comment section? Yeah, this we discussed few days back. This we discussed a few days back. We have. I'm so excited. I should decrease my excitement. Literally, my mom says you are like a child only. My mom, I tell you one thing. My mom says that, "Ayo, Babu, मुझे घर पे ना बाबू बुलाते हैं. They call me Babu at home. So they're like, Babu, do people come and show you on OPD? I was like, obviously, mom, people come and show me. Like people come and show you. You are like a kid only. You behave like a kid. You talk like a kid, and you're happy for no reason. तेरे को आते हैं patient दिखाने. Do the patient come and show you?" And I was like, hello mom, I have the highest OPD. People jump and come and show me. I have the highest OPD when I sit in the OPD. So it's like, cute. Yeah. A 4-year-old child with seizures. What is the first line of management pertaining to D? D से कोई गाना बताओ. डी से मुझे आता है. दिल तो है दिल का एतबार क्या कीजिए, आ गया जो किसी पे प्यार क्या कीजिए. Yeah, that's right. So please remember, bro, in the beginning we used to do ABC, right? Airway, breathing and circulation. In any things management, a child with seizure, a child with shock, a child with status epilepticus, status asthmaticus, any child coming to casualty. If you are a JR or SR giving interview, अच्छा हमारे hospital में interview है. In our hospital we have this week we have interview for JR, junior resident. For the post MBBS students we have the interviews of JR this week, and I think some 50 or 70 seats are there, and some more than 500 students will apply. If you interested, message me. We will see if we can do something, because it's a government hospital and you have to just apply and do your best job. Okay, yeah. And why did I say that? Because my HOD always, he wants to hear one thing. They ask like, how do you manage a case of neonatal seizure? How do you manage? Okay, I'll ask you, how do you manage? Okay, I'm the external. Okay, you are the student. Okay, let's play the game. Hanji, Dr. Shubham. Doctor, what's your name? Shubham. Shubham. Okay, nice name. Dr. Shubham, if 4 days old baby, 4 days. Dr. Shubham, 4 days old baby have come to you and he came with seizures. How do you manage this case? Dr. Shubham, could you answer in the comment section, please? 4 days old baby came with seizure. How do you manage this case? Can you, anyone tell me, please? Yes, important. Anyone? Exactly. Anyone? Okay, I think we have got the beautiful answer. Shubhangi is right. We have nursing block. Yes, you're right. Karan, Suman, Karishma Singh and Shubham. Very good. Before, हाँ सर आप अगर सर हुए तो मैं हंस दूंगी. ओके, मैं भी हंस दूंगा एक्चुअली. वैसे मैं रहता हूँ उसमें ना एग्जामिनर में. ओके, सी ब्रो लिसन वेरी केयरफुली. 4 days old baby came with seizure. ओके, हाँ देखो किसी ने बहुत ही मुंह से एक मोती जैसे शब्द निकाले हैं. डॉक्टर शुभम सेज phenobarbital. डॉक्टर शुभम सेज phenobarbital. This only I wanted to hear from you. Okay, so this is the wrong answer. Hello, this is the wrong answer. If someone tells you, how do you approach a case of neonatal seizure or any question, any emergency, if they ask you, you open your mouth, open your dirty mouth, and what will you say? You will say TABCD. This is what you have to say. My HOD wants to hear that. Okay, same thing. One of my juniors, she said that, okay, sir, midas denge, sir, phenobarbital will give, sir, phenobarbital. He's like, oh, directly you'll give phenobarbital. Directly you'll give phenobarbital. Don't you want to manage the child? What about airway, madam? You don't do airway? Airway, breathing, circulation from your $1 million mouth. You should open these terms, okay? Temperature, sir, temperature will see airway, breathing, circulation, and disability. This you will open your mouth. Are you understanding? Please put a like button in the comment section, or you can give a black or a blue heart also, I don't mind. Hanji. Rule out causes first. Yes, Dr. Osama Sheikh, PhD holder from Jakarta, but you will say TABC, bro. Sun rahe ho everyone? Are you understanding? Please remove your earwax, show to ENT, and then listen to this point. Sir, you will always say, sir, we will manage the. This is, I'm telling frankly, because this is what the HODs wants to hear. Okay, everyone knows phenobarbital, but they want real approach. Sir, the patient will come. First, sir, we will manage. First, do drama. Okay, first, as they say, like you are thinking like very hard. Sir, okay, okay, yeah. So, sir, actually, I would like to maintain the temperature, airway, breathing, circulation, and disability, sir. And sir, then I would like to give the drug of choice. Like, and the HOD will say, wow, this fellow is good, Dr. Anand is good. समझ में आया या दिमाग के ऊपर से गया? Has everyone understood this much? Yes or yes? Like whatever I'm telling you, okay, like I'm telling you very frankly, because this is real scenarios of my life, and this is my job on this planet till the time I'm living. It's my job to share beautiful knowledge with you, and this is a good knowledge which I'm sharing with you. Okay, number one, whenever a patient comes to you with emergency, say temperature, airway, breathing, circulation, disability. Number two, very importantly, one thing more, remember, okay, if someone asks you a question, okay, listen, see, I have given a lot of interviews. I have failed a lot. I am a topper in failing. Okay, if it comes to failing in a list, I am very good. I have gone to army exam. मैंने थल सेना में, वायु सेना में हर जगह interviews दिए. I have given interviews in short service commission, but then I got rejected in the physical because I have done LASIK. I have done operated in my eyes, and there is some prerequisites for that. So they ask a lot of questions. Okay, and whenever someone asks you a question in interviews, don't open your mouth suddenly. Take a 5 seconds pause, 3 to 5 seconds paused. Just think, incorporate words accordingly in your mind, and then say, sir, if a patient comes seizuring, I would like to maintain temperature, airway, breathing, circulation, and then disability, and then I would like to go for phenobarbital. Are you understanding? ठीक है, डोज बता दो. ओके, नहीं बताऊंगा, क्या करोगे बताओ? Dose, yeah, I'll tell you, bro. In a case of neonatal seizure, if someone is asking about the neonatal seizure, the drug of the choice is phenobarbital. The drug of the choice is phenobarbital. Phenobarbital has a loading dose, and phenobarbital has a maintenance dose. Phenobarbital and the maintenance dose. Loading dose you give at the rate of 20 mg per kg, and maintenance dose you give at the rate of 5 to 8 mg per kg per day. But frankly speaking, it is for the for us MDs. Like in general, for the NEET, PG, and Hfmd in the exam paper, they don't ask this question. Okay, remember that. Next question, please. Yes. So next question we have is, Hanji, chalo. Good question. These are very good questions. Like when I was preparing this question, it was a good time when I was preparing, because it's a like nice question, easy, like it's a good quality question. It's not cramming. It's literally conceptual based questions. A 4-year-old child with cough, fast breathing, had following X-ray finding. What is the next best step in management? Following X-ray finding. Let me show you the X-ray. Yes, a beautiful X-ray. Can you answer in the comment section, please? Amrit bhi aaya aaj, very good. Amrit, Osama, Radhika, Mansi, Grace. Yes, Grace, I am like this only, bro. I'm so sorry. Karan, Hanji, what do you think, bro? What do you think? Swaraj, Suman, Hanji. So this is, I think you know that, like this is a laryngeal spasm. This is a laryngeal spasm. Larynx ka spasm ho gaya hai. This is a laryngeal spasm, and this is nothing but, I hope you know that, this is steeple sign. We all beautifully know that. Where do you see steeple sign? Your steeple sign you see in croup. What is the other name of croup? The other name of croup is acute laryngotracheobronchitis, laryngotracheobronchitis, okay, laryngotracheobronchitis, very importantly. Okay, what else? Yeah, this is steeple sign. Steeple sign is seen in croup. The other name of croup is acute laryngotracheobronchitis. Or kya? This is larynx, this is windpipe. Okay, this is windpipe, this is a spasm in my windpipe. This is laryngeal spasm. It's not a food pipe, bro. Hanji, very true, Dr. Suman, very good, very good, dear. Acha, और क्या question था? हाँ, which is the most commonest organism? Anyone? Which is the most commonest organism in the group? Can you answer in the comment section, please? Hello. Hmm. Yes. Can you? Which is the organism, bro? Organism. दिल से पढ़ो, please. Life बहुत छोटी है. Study properly, okay? Please. Life is so beautiful. I'm frankly telling you, if you have good knowledge, then only people will respect you. If you don't have knowledge, people will take you for granted. So there should be some quality in your knowledge. There should be some quality in your soul. People, if you're good at your job, people are gonna come to you. So be good at your job. The most commonest organism, para-influenza virus, dear. Para-influenza virus. Group का तो para-influenza होता है ना? हाँ. Para-influenza. कोई बात नहीं शुभम. Para-influenza virus is the one you should remember. Not the streptococcus. In the group, it is para-influenza virus. And हाँ. Double check. Okay. Let's check. Let's check right now. Because I'm sitting at my home and I have a laptop. भगवान की दया से. Okay. Respiratory system. Can we open respiratory system? Can we open crop? Yeah. Okay, 1 second. Yes. Ooh. Can we have this $1 million slide? Can we please see that in this beautiful picture, bro? So we have the para-influenza virus. Common cold, the most commonest cause is rhinovirus, pharyngitis, adenovirus, croup, para-influenza virus, whooping cough, bordetella pertussis, and bronchiolitis. Bronchiolitis is respiratory syncytial virus. Yes. Has everyone understood this much? Yes or yes? Pehle put a like button or at least just tell me yes, and then I will move further. That's it. Tell me. मजा आता है ना पढ़ने में, मुझे मजा आता है. Do you guys enjoy this class? I don't know. Sometimes I think I don't know what I'm teaching, but sometimes I feel it's beautiful. It's very important to share your experience, frankly speaking, because experience is something which you can't buy. You can buy money, you can buy a degree, you can buy a college, you can buy anything, but maturity you can't buy, experience you can't buy, intellect you can't buy, precision, I mean maturity, experience, seeing patient. Like we have our amazing many faculties in my hospital. They are amazing. We have one doctor, his name is Dr. Dogra. He's so amazing, and I love his intellect. His knowledge is so beautiful. We had a patient recently, like of thrombocytopenia. I want to share one thing with you. I remember one thing. He had a very beautiful intellect. He has what he called we had a patient of thrombocytopenia. Okay, the patient was having some petechial rash. Let's see if you can diagnose this case. Patient was having some petechial की spelling गलत है, don't mind. Patient was having some petechial rash, and we thought of thrombocytopenia. The patient got fever. That like in right? Like what do you think? The patient got fever, and then the patient was afebrile, and then the patient was kind of recovering well. So what do you think? Which picture does it fit into? Can you answer in the comment section? What do you think? Okay, Moni, what do you think? Organism for bronchiolitis is respiratory syncytial virus. So this patient I want to discuss with you, if you guys can manage to answer me. We had this patient with repeated thrombocytopenia. He has a petechial rash. I still have the photo of that patient. The patient was having fever, and then what do you think is the best answer? Dengue. Yes, Amrit is right. Actually, हमने dengue सोचा था. We thought of dengue only, frankly speaking, because the patient was having fever and petechial rash, and with thrombocytopenia, it was fitting in the dengue. And then his fever came down, and he was recovering well, eating this and that. But like he was there with us for 18 days. I remember, for 18 days. But his platelet count were like 60,000, 50,000, 65,000, 70,000, again 50,000, 60,000. So this is what the chain he was following. Okay, so now what do you think? So now, of course, I think like once we took Dr. Dogra was on round, and he was so amazing, and he's like, this patient is ITP, bro. He's like, okay, sir. Then he was like, this is a idiopathic thrombocytopenic purpura, and because the patient, like, he's like, get this thing done, what he called bone marrow, and then we got the relevant investigations done, and it was actually a case of idiopathic thrombocytopenic purpura. And then I was reading about it, and nice questions we were reading about it. So it was nice. Could it be leukemia? In a way, like, you get a peripheral blood smear, no? You get a peripheral blood smear. If it was actually leukemia, you would have got blast cells, and you would have got a different biochemical blood picture. You would have spoken to the pathologist. They would have told that this patient's blood report is showing some leukemic picture, because you are in touch with the biochemistry people, right? If you have some dicey reports. So that's what the patient who was of dengue fever came out to be ITP, actually, idiopathic thrombocytopenic purpura. So it was fun. I really liked it. We got a bone marrow done, and we diagnosed it very nicely. And because we need to rule out thalassemias, leukemias, and other things also. But I was very happy that the way he discussed the case, and it was good. Like, I liked it, and frankly I liked it. And then we got diagnosed, and the patient comes in follow up with me and with sir also. It was good, actually, and mother was very happy. So and more than the mother, I was happy. I was like, good, yeah, I got something new to learn. That's what. So can we have the next? Okay. So this patient got the X-ray finding. This patient was a case of apna group. So could you please answer in the comment section, what is the best line of management? Anyone? Sahi hai? Okay, yes, exactly. Oh, Shubham keh raha hai, bhai mera. Yes, bro. Thank you, bro. So, Hanji, what do you think, bro, in a case of croup, bro? What will you write? You write steroids for antibiotics, steroids for antibiotic with adrenaline, steroids only, steroids for ADR. What do you think? Anyone answer in the comment section? Exactly, exactly. Orion says, thanks a ton. Your tip is helping me a lot to Shubhangi. That's great. Hanji, okay. Okay, everyone says C, actually. Okay, C. Okay, frankly, if I tell you, I think steroids plus ADR sounds a better answer. In a case of croup, okay, in a case of croup, steroids, dexamethasone plus ADR nebulization. Dexamethasone and ADR nebulization, for me, I personally feel that's the best answer, and steroids plus antibiotic, like, you should know that there is no role of antibiotics in croup. Antibiotics have a role in acute epiglottitis. Antibiotics has a role in acute epiglottitis. Yeah, antibiotic have a role in acute epiglottitis. So A and B is out. Steroids only or steroids for adrenaline, like, as we know, the management of what you call croup is dexamethasone plus ADR nebulization. So best answer, like, if I say best answer, then I think D sounds more better answer. Some book they have told that what you called if the patient is very sick, then you give ADR, but I think steroids for ADR, as far as I know, sounds a good answer. Next question, please. Yeah, which is the most common seizure in a newborn? Nice question. Very nice question. Can you answer in the comment section, please? Macrolides given acute epiglottitis. Nahi, dear Dr. Shubham, I'm sorry, but cephalosporin is third generation. Ceftriaxone is given in the acute epiglottitis. In a case of acute epiglottitis, you give cephalosporin is third generation. That is ceftriaxone. Macrolides ka matlab hota hai erythromycin. And remember, and roughly, if I say about erythromycin or even doxycycline, they give in a case of this one, what do you call, kisme doxy dete hain, that cholera. The drug of choice for cholera is doxycycline. If doxycycline is not there in the option, then erythromycin also we give. In our hospital, we give doxycycline, 5 mg per kg start dose we give. Yeah, exactly. Next question, which is the most common seizure in a newborn? A, B, C, D? Very beautiful answer. There are so Karan says, okay, 1 second. My question was, which is the most common seizure in a newborn? Okay, Karan says C, Shubhangi C, और क्या है? अल्फाज C, करिश्मा C, okay, स्नेहा C, और कोई महान आदमी अमरनाथ यादव C, मानसी पनोला, सोने सोने पटोले लखा, okay, C, और कोई महान आदमी, any amazing personality who want to say C, A, B, C, D? Okay, so the best answer for this question, the most common seizure in a newborn will be a hypoxic seizure, because febrile seizure, the most commonest age to be 6 months to 5 years. You need to understand the question properly. I have rephrased the question. It's a recall question. Okay, so I've rephrased it. If the question was most common seizure in a child, the most common seizure in a child will be febrile seizure, and I think we have spoken about it many times. I have told you, yes, Dr. Lalit Yadav, RJ, Ritu, Osama, Sangram, Karan. अरे D है sir, D nahi hai, sir. Do you remember, guys? Osama, we have spoken about it. Which is the most commonest cause of seizure in a newborn? The most commonest cause of seizure in a newborn is hypoxia. Hypoxia, right? See, listen very carefully. Listen, I want to share one thing with you. Like, you have to choose the closest best option, right? You have to choose the closest best option. Are you understanding? Again, I'm repeating this word. It's important, bro. You have to choose the closest best option, right? Like the most right option on this planet. The most common seizure in a child will be subtle seizure. Subtle seizure, if I talk about, right? Most commonest seizure in a child is subtle seizure, okay? Because that's the most commonest type of neonatal seizure is subtle seizure, newborn may. And the cause of newborn seizure, what is the most commonest cause of newborn seizure? We had discussed about it. Baby पैदा होके नहीं रोया है. That is the most commonest cause of seizure in a newborn. ये बहुत बड़ा लिखा है यहाँ पे. It's written very big over here. Newborn. The most commonest cause of neonatal seizure will be hypoxia. Baby has not cried immediately after birth, leading to hypoxia. The most commonest type will be subtle. Febrile तो किसी भी हालत में febrile on this planet for this question is not at all possible, because febrile seizure, the most commonest age group is 6 months to 5 years, and febrile seizure is very common in a child, baba, in a child, not in a newborn. Child, okay, child. What is child? Like 6 months to 5 years is a child. Newborn is not a child, okay? Yeah, exactly. Yeah, that's what Isra Mustafa says. Is there any explanation regarding febrile seizure more common between 6 months to 5 years? No, there is no explanation. That's how it is, my dear. That's what they have. That's how they have told in the book. 6 months to 5 years is the most commonest type of most commonest age group for febrile seizure. Acha, absence seizure. What's the drug of choice for absence seizure? The drug of choice for absence seizure will be ethosuximide. And if ethosuximide is not in the option, then sodium valproate. Sodium valproate. I hope you agree with me. We have done this before. Yes, exactly. HI होता है ना सर? हाँ, HI होता है ना सर? HI का फुल फॉर्म क्या होता है? Hypoxic ischemic encephalopathy. So hypoxia. There is hypoxia, right? That is the cause for seizure. So hypoxic seizure, you can say the cause, like, are you understand, like, if the perfect question would be which is the most common cause of neonatal seizure, cause will be hypoxia. Very importantly, what you called, yeah, cause will be hypoxia, and type will be subtle. Are you understanding? At least the understanding, I want to get the understanding concept for this one, okay? Cause will be hypoxia and type will be subtle seizure. Are you getting it, bro? So that you should know. Perfect. Okay, that's it. Okay, like, you should get the concept. That's what I want. I'm very particular in that concept. You should get the concept. Okay. Okay, please, last few questions. Hanji, if you look at this picture, just this picture, what is the answer? This is a good question, actually. Anyone? Yes, only this picture. If this picture comes in the exam, what do you think? Okay. Anji, what do you think, bro? What do you think? Okay, spelling देख लेना sir. अच्छा, ठीक है dear, ठीक है. Ethosuximide and sodium valproate. Sodium valproate is the one. Yeah, you're right. Who said this? Sangram Kumar. Very good, bro. Very nice. So can I what do you called class link? Okay, yeah. Can I say this is the hand? Can I say this is the foot? And can I say this is the mouth? है ना? So this is hand, foot and mouth disease. It's HFMD. Hand, foot and mouth disease. And what is the organism responsible? ABCD. Anyone? Could you answer in the comment section, please? Yes. Very good, bro. Very good. What is the most commonest organism for this, what do you called, for disease shown below? I think you all know that. So for the most commonest organism for HFMD is Coxsackie virus A16 and enterovirus. According to our beautiful OP guy, this is what they have told, that OP guy 9th edition beautifully says that Coxsackie virus A16 and enterovirus are the most commonest cause of the HFMD, hand, foot and mouth disease. Steeple sign is done. This part is over. Yes. That finishes the first half. That finishes the first half of this class. Very importantly, yes, so now 55 minutes are over. That finishes the first half of the recall questions of NEET PG 2022. Has everyone understood this much? Frankly, tell me yes or yes. What do you think, guys? And before leaving, we always have a beautiful quote. And the most beautiful close, yes, exactly. Achha, theek hai. So the most beautiful quote for today class will be humble. Be humble. We all have a past. Be humble. We all have a past. Okay. So you be humble. Don't be harsh on people. Take life light. Have a little smile on your face. I have a mobile alarm. I have a mobile alarm in my mobile in the evening that have a smile on your face. And whenever I enter gym, I have a little smile, little, not like very smile, little smile on my face. Because very smile looks very bad. People say, hey, why is he so happy? What is the problem? So number one, try to have a little smile on your face. Be humble. We all have a past. So thank you so much for all the love and support. Also at the same time, I want you guys to have a lot of beautiful plants bedside. Do you guys like this beautiful plant? I had gone to Jaipur, and from the Jaipur airport I got this small petal of this money plant. So we got a double money plant now. So do you guys like this beautiful money plant? It's amazing. You should have money plant. It's bring good vibes, bro. It's bring good vibes. Okay, that's why. Okay, hanji. Alarm kaun that it's a mobile alarm in my mobile that smile. Sometimes we forget to smile. We get so busy. So it's like a reminder to me itself that smile, bro. Chill, relax that way. Yeah, okay. The 5 question, as Dr. Shubham is beautifully stressing for the 5 quick questions. Question number 1, what is extremely low birth weight? Yes. Question number 1, what is extremely low birth weight? Can you answer in the comment section? What is extremely low birth weight? Anyone can answer in the comment section, please? Yes. What is extremely low birth weight? Exactly. So we talk about money plant, money plantain. Okay, great. Yeah, extremely low birth weight. Yes, we have less than 1 kg. Less than 1 kg baby will be a extremely low birth weight. Dr. Shubham, perfect. Very good, bro. Very good. Yes. Dr. Dalip, great. Perfect. Next question, please. Okay, let me ask you tough questions. Which are the 3 syndromes? Which are the 3 syndromes which are associated with Wilms tumor? What are the 3 syndromes which are associated with Wilms tumor? What are the 3 syndromes which are associated with Wilms tumor? Can you answer in the comment section, please? What are the 3 syndromes which are associated with Wilms tumor? Okay, Alfaz, Sohan, Dilip, Lalit, Vishwas. Okay. Vishwas, are you the guy from our student from apna Jaipur class? Because this is a nice fellow known as Dr. Vishwas. Okay, the 3 syndromes associated with Wilms tumor are, I think we have done it before. So we have Beckwith-Wiedemann syndrome, very importantly, Beckwith-Wiedemann syndrome, number 1. Number 2, very importantly, anyone? Denny-Drash syndrome, Denny-Drash syndrome, and Vager syndrome. These are the $3 million. किसने बताया? Karan. Very good, Karan. ये मेरा पेन गिर गया, एक सेकंड. Yes, yeah. So the 3 syndrome. Yes. सर एकदम से क्वेश्चन बता दो प्लीज. एकदम से क्वेश्चन अब आंसर तो करोगे ना डियर पहले. So the 3 syndrome associated with Wilms tumor are Beckwith-Wiedemann syndrome, Denny-Drash syndrome, and Vager syndrome. Okay. What is the iris finding? What is the iris finding in a case of Down syndrome? What is the iris finding in a case of Down syndrome? Can anyone answer in the question comment section? हाँ जी, एकदम से क्वेश्चन बता दो. एकदम से डियर आंसर तो करोगे ना डियर, कैसे बता दो एकदम से क्वेश्चन यार, मुझे भी सोचना पड़ रहा है एक्चुअली. यस, सो सबसे पहले मैंने दिया दैट ओसामा. वेरी गुड ब्रो, ओसामा. लिख तेरा नाम, रुक तेरा नाम लिखता हूँ पहले. Dr. Osama has given the first answer. Very good, Dr. Osama, with little hair on the scalp. Hanji, the iris finding, Dr. Shubham has told the right answer. Brush field spots in the iris. Brush field spot in the iris. That's the 3rd question. Very well put. That's the iris finding. That's very true. Next question, please. Question number 4 and question number 5. Each 100 ml of breast milk contains how many gram of lactose? Anyone? Each 100 ml of breast milk contains how many gram of lactose? Can you answer in the comment section, please? Exactly, Hanji, Vishwas. Yes, Vishwas, Raj, Himanshu, Isra, Karan, Anu, Monimala. बहुत सारे लोग हैं. Yeah, that's very good. Priya, Shubhangi, anyone? Yes. Each 100 ml of breast milk contains 7.4 gram of lactose. 7.4 gram of lactose. That's very, very important. Okay. Next important, yeah, exactly. Next question, please. Okay, okay. 7.4 is the right answer. Awesome. Faizan, Alfaz, Osama, and yeah, Osama, very good, bro. Osama, very good. Okay, one more question. Okay, one more question. Okay, a baby with single eye, a baby with single eye and no nasal chamber, a baby with single eye and no nasal chamber. What do you think? Can you have the best answer? Is the last question. Yes, Anu? Yeah. A baby with single eye and no nasal chamber. A baby with single eye and no nasal chamber. The answer, the best answer for this question, कौन बताएगा? I think you know it. Yes, very good. The best answer for this question, the patient is suffering from holoprosencephaly. Holoprosencephaly is the entity which comes to my mind where the baby with single eye with no nasal chamber. Yes, and so, okay. That finishes this today's class. Thank you so much everyone for this.